Hello and welcome back. My name is Joseph Tsuma, always your favorite doctor. And when you see me here, you know it is Matters Health. I'm here to bring you trusted health information wherever you are. You can follow me for simple, updated, practical, and reliable medical insights that will be able to keep you and your family healthy. You can also follow me on YouTube at Dr. Wheels. You can also follow me on TikTok at Dr. Tsuma. So I want us to continue with our series that we had started before on the causes or why your doctor actually advised you to undergo a cesarean section, or in other words, the indications or causes of cesarean sections. And today I want us to discuss previous scar as an indication or as a cause for you to actually undergo a repeat cesarean section. But before we dive into today's topic, I want us to listen to some words of wisdom from the book of Proverbs, chapter 18, verse 10. And the Bible says, "The name of the Lord is a strong tower. The righteous man runs to and he is safe." So let us dive into today's topic. So, what is a previous uterine scar? So, a previous uterine scar means that a mother has undergone a previous surgery. Okay. Now, in the process, the doctor went ahead to cut through the uterus to remove the baby, and after removal of that baby, there was a wound, and that wound actually healed with a scar. Now, that scar might not be very strong, okay, for it to allow for the subsequent contractions in the subsequent pregnancy, okay. Now, if care is not taken well, okay, that scar, basically because of those strong contractions, it can actually rupture. And if it ruptures, it can be very dangerous for both the mother and the baby. And that's why most of the time doctors will advise, because of the risk of rupture of that uterus, okay, they might advise you to actually go ahead and do a repeat cesarean section. Now, when is an indication for cesarean section? Okay, so why do we indicate for a repeat cesarean section? So number one is that when the previous scar is a classical or a vertical incision. So if the previous pregnancy, the doctor went ahead and cut the uterus in a vertical manner like this, okay? Because a vertical scar, most of the time it's very weak, but also it is so much prone to rupture. Okay. Number two indication is if you have had more than two previous scars, so which means you have had more than two deliveries by a cesarean section. Okay. Therefore, the third one, the fourth one, and the subsequent ones, most of the time they will be cesarean sections because the doctor will want to risk. Number three is if you had complications in your previous delivery. Okay, so you had a cesarean section previously, but then you ended up with complications like delayed wound healing, or you had an infection at the incision site, or you had a lot of bleeding during or even after delivery. Okay, some of those complications might repeat themselves and they might be worse during this time, especially if you want to try a vaginal birth after cesarean section, and therefore the doctor will not allow that and will indicate or will advise you to undergo a repeat cesarean section. The other thing is, or the fourth reason is, if the doctor has a doubt of the integrity and the strength of that scar. So how, let's say for example, you underwent a cesarean section, but it has taken less than 2 years since the last delivery or the last operation. Okay, so it means that that scar might not be very strong, so the integrity might not be so good, and that's why your doctor might indicate and say you need to undergo a repeat cesarean section. And number five is that if the hospital that you are about to deliver does not have the facilities for you to be able to be allowed to try vaginal delivery after cesarean section. Let's say, for example, you're giving birth in a facility that does not have the capacity to make emergency decisions. okay? In case a rupture happens, you need to be able to have the facilities. If the anesthetist is that kind of a person who needs to be called and then takes more than 30 minutes for them to be in the hospital, they might not be able to allow you. Okay, so if you don't have that facility, if you're giving birth in a hospital that does not have the facility, the ability to initiate emergency procedures and be able to execute them as fast as possible, they might not be able to allow you. And the doctor might just say, let's just do a cesarean section. Now, you need to understand the risks, okay? Even as we make decisions on vaginal delivery, you need to understand the risk. Now, in case of rupture, okay, you might end up with a lot of bleeding, and this bleeding basically can cause shock to the mother and can actually lead to death of the mother. But then also it can lead to fetal distress and it can lead to actually death of the baby as well. So without care, you can actually lose both the mother and the baby. Okay. Now, because of these dangers, okay, the doctors might just indicate and say you just need to go ahead and do a cesarean section. Now, there are people who have asked me in different quarters, is it possible for me to give birth normally even after cesarean section? Yes, it's possible, but we need to weigh the pros and cons even before we allow you to basically deliver normally. So these are the things that if they are able to satisfy them, then we can allow you to deliver normal. So number one is that the previous scar, okay, the previous reason why you went ahead, the previous scar should be a lower segment and it should be a transverse, not a vertical, okay? And it should be on the lower segment of the uterus. Number two is that it should be more than 2 years, okay, since the time you delivered normally. Number three is that you should not have had complications in your previous cesarean section. Number four is that the cause that actually made you to undergo cesarean section should not be a recurrent cause, okay? Like for example, it shouldn't be something like contracted pelvis, pelvic disproportion and all that. It should not be a recurrent cause, okay? And number five is that the baby should be within the required weight, okay? So if the baby is more than 3.5 kgs, most of the doctors wouldn't allow you to try vaginal birth after delivery. So the doctors, we will be able to assess, okay, and weigh the cons and the pros, the risks, okay, and be able to make a decision. And number six is that the hospital that you have planned to give birth should have the capacity to initiate emergency medical care. Okay, that in case we have had a rupture, okay, you can actually be taken to theater within probably 5 minutes and we get that baby out. Okay, but also we need to have the specialized doctors who will be able to either are in a position to either repair the uterus in case it ruptures, or okay, or they are in a position to actually remove the whole of that uterus in case the bleeding is too much and you have to save the life of that mother. Okay, so how do you prepare for safe delivery? So number one, you need to attend all your antenatal visits, okay, for monitoring of that scar. Number two, you need to report any kind of pain, bleeding, or abnormal symptoms that you might be having. Okay? So, any kind of pain, especially around the scar, you need to report it so that we are able to assess you and be able to ensure that there is no any kind of fracture and it is just normal pain. Number three, you need to plan for delivery way before, okay? Before the labor starts. So you don't wait until the labor starts and then you're starting to think, where can I give birth? Okay, you need to plan way before the hospital that you want to give birth, okay? And then the hospital that you choose needs to be a hospital that is able to, number one, do surgeries, but also they are able to do blood transfusion, because sometimes you might lose a lot of blood and you might need blood transfusion. okay? And then you need to avoid home deliveries at all costs, okay? If you have had a previous scar or you have had delivery by a cesarean section, the next and the subsequent deliveries must always be in a hospital setting, okay? Because if you try to do it at home, okay, and that 10, 15 minutes or even 30 minutes from home to the hospital, you might have lost the mother and you might have lost the baby as well, okay? Now, you also need to follow your doctor's advice, okay? So whatever the doctor advises you, you also need to be able to follow, okay? Now, what is the key home, the take-home message here? So number one is that a previous scar on the uterus, okay, needs special care. So every time, and that's why here in our hospital, once you have had one previous scar, you are already categorized as among the mothers of who are at high risk. So you need more close monitoring and more follow-up in your subsequent pregnancies. Okay, you need regular checkups. So with regular checkups and hospital delivery and good medical guidance, both you, the mother, that is the mother, and the baby can remain safe, and you can have safe delivery and can have a healthy mother and a healthy baby. Now, if you have found this topic and this discussion very helpful, please consider subscribing to our YouTube channel at Doctor on Wheels. You can also follow me on TikTok at Dr. Zuma. Now, if you have any question about this topic and even the topics that we have discussed before, don't hesitate, okay, to visit us at Zawadi Premier Hospital. We are located at Loopsil Center, opposite Juanco Petrol Station on the ground floor. You can also call us or you can also text us via WhatsApp at 0742 933 913. Until next time, God bless.